Good afternoon. I'm going to talk to you very briefly about three projects which have had an impact led by mental health nursing researchers. First one, Safe Wards, which was led by my predecessor here at King's, Len Bowers, and I was a co-investigator on. This was a 5-year program of research aimed at reducing the levels of conflict and containment in inpatient mental health settings. By conflict, we mean things like aggression, people absconding, rule breaking, and so on. By containment, we mean measures that staff tend to employ to try and manage those situations. So restraint, seclusion, medication, so on and so forth. So over the 5 years, a range of possible interventions that would be nurse-led were explored. Over 300 were considered and whittled down. This was based on a body of research that had been going for about 14 years. And we ended up with that list of interventions in the centre there. And if you want to find out more about those interventions, just put Safe Wards into Google. Everything's freely available and you can download and find out more. What's particularly interesting about this programme of research is at the very beginning, we recruited a group of mental health service users and carers, which we facilitated, who would meet with us throughout the whole 5 years of that programme of research to discuss and explore and collaborate on all aspects of that study, from the initial design, from considering the ethical issues, but also, most importantly, helping decide on the interventions that would be used by talking about, considering, reflecting on, looking at the pros and cons of different possible interventions that would be used. The trial ended up a cluster randomised controlled trial across 31 inpatient wards in England, conducted with the Safe Wards intervention trialled against another intervention on another group of wards. And we managed to find a reduction of 14% in levels of conflict and 24% in the rates of containment measures used in that study. The impact has been absolutely enormous. So this is a nurse-led intervention which is now being employed across the world. So there's inpatient units across all of these countries that have been implementing Safe Wards, and the actual website information has been translated into a number of different languages. And just yesterday, there were people from Indonesia meeting with Jeff Brennan, who leads on the Safe Wards implementation in London, with a view to implementing it in some of their wards in Indonesia. It's had an enormous impact, probably more impact than any other mental health nursing innovation ever. Peer support. Peer support is something that's happening across healthcare now, and particularly in mental health, where people with lived experience of a particular condition or service use are encouraged to draw on that experience to support other people going through similar experiences. We started our peer support study because of something a service user said when we were talking about and interpreting findings from an earlier study, which we'd looked at conflict and containment on inpatient wards. And 60% of the patients said they were nervous about going back home, leaving the support of their staff and their peers on the wards and going back home, often quite isolated situations. And the service user researcher, Diana Hackney, said what you want is a buddy scheme where people who've had that experience, been through it, would support people when they're discharged from hospital. We managed to get funding for a pilot randomised controlled trial looking at just that, and we set that up in Hackney in East London. There's the group of the first lot of peer support workers who completed their training. So they received a 12-week training and then were employed to go and support people in the first couple of weeks before discharge and then 4 weeks post-discharge to see if we could help people settle back home and so on and so forth. It's a particularly risky time for people leaving hospital. We know 8% of all community suicides happen amongst people who have recently left a mental health hospital. It was highly effective. It's led to a large randomised trial of the full intervention now, which is currently underway. We've just completed recruiting 600 patients into that study, and the reports will be due in about a year's time. It also had an impact abroad, where colleagues of mine working on a link between Uganda and East London took out the intervention into Uganda and have been developing peer support amongst people working communities in Uganda with people with mental health problems. And very finally, care planning and care coordination. We were funded to conduct 2 large cross-national studies, mixed method studies in England and Wales, looking at recovery-focused care planning and coordination amongst people with severe mental illness first of all in community settings, and secondly in inpatient settings. In a nutshell, we find a variety in delivering experiences. Relationships were key, and we need much more involvement of service users in discussions around their care and their risk and safety. The findings of that are informing a new national framework around community mental health services, which is going to be launched later this year. Thank you very much.